So good evening, everyone. Thank you for joining us for tonight's virtual town hall. This is a first. Of course, COVID-19 is a first for us here, but we definitely want to make sure we can get all the information that is pertinent to you and important to you today from our local states and from our federal governments, as well as our local leaders. We are so thankful for all of you who have come in tonight to make this a very special event so that people can then feel that they're getting the most up-to-date information from those who know. Now, of course, making up tonight's panel, we are excited to welcome Representative Kandie Smith of District 8, who was so wise in putting all of this together for us tonight. We also will thank Congressman G.K. Butterfield. He is, of course, the representative for House District 1. We also have Senator Don Davis of District 5, who is joining us tonight. Mr. Lilley, who is the Director of Legislative Affairs for the Office of Governor Roy Cooper. Sheriff Paula Dance of the Pitt County Sheriff's Office is joining us here tonight, as well as Dr. Michael Waldrum, the CEO of Vidant Health in Greenville. And we have Dr. John Silvernail, Pitt County's Public Health Director. Thank you all so much for being here with us tonight. Now, we will begin with a brief opening statement from each of our local leaders, followed by a question and answer segment that will last about 30 minutes. Now, the questions during the segment come directly from you, the viewers who are watching right now. Now, we ask people to submit their questions ahead of time, so if you didn't have a chance to do that, we do ask you to submit them now. And you can do comments live on this live video feed, and we'll answer questions and go from there. So if you have a question while we're watching, be sure to definitely ask. Now, following the questions segment, we will conclude our night with brief statements from each of our local leaders. Now, we do have a lot to cover tonight. We're going to do this all in 1 hour, so we're going to get right to it. We want to begin with opening statements from Representative Kandie Smith.
Well, I want to start by saying hello to everyone. I am Representative Kandie Smith, representing District 8 in the State House of North Carolina. I represent northern part of Pitt County. And I just want to thank you all for joining us and thank my fellow local leaders and federal leaders who've taken the time out of their busy schedule to answer very important questions from the public. So thank everyone who's joining us to get information as well.
Thank you very much for those comments. Now we'll have a few moments again to hear from each of our participants tonight as they take questions from our constituents. But first, I want to ask you all the same question. The first question of the night will give each of you 1 minute. The question is, what has been the most common issue you have been hearing from constituents, and is there a solution to the issue, and what is that? And Dr. Silvernail, we'll begin with you tonight.
Great. Thank you, Lynette. Good evening, folks. I think the questions that we get are probably most commonly around how many cases of COVID-19 are there in the county? How fast is it spreading in the community? How does it spread? And what can we do to protect ourselves? So the hard numbers, as of late this afternoon, we had 80 cases of COVID-19 in Pitt County. They're spread throughout the county. That represents about 18.4% of those tested. So a little less than 1 in 5 people with symptoms who are tested are testing positive for COVID-19, which means a little over 80% or a little over 4 out of 5 tested with symptoms are not testing positive for COVID-19. I think those are good things for our community. How does the virus spread? The virus spreads predominantly by respiratory droplets, which means when someone coughs or sneezes, they expel that virus as a respiratory droplet. And those droplets on average can travel about 4 to 6 feet, and that's where the 6 feet apart rule comes from. The other way that it spreads is that sometimes those droplets can persist on a surface, generally a hard surface like a doorknob or a countertop, and that someone might be able to get those droplets on their hands unknowingly and then touch their eyes or nose or mouth and inoculate themselves with those droplets, thereby giving themselves the infection. You might say, well, how long does it last on a surface? And there's quite a bit of dispute about that. At one point, the state health director said 3 to 6 hours. Myself and a local colleague had looked at some material, and we came up with a number of maybe 6 to 8 hours under the best conditions possible. I've seen estimates that are shorter than that, and I've seen estimates that are longer than that. I would caution folks in interpreting some of those persistence studies, because they often rely on what's called a wipe sample, which means that you go out and you wipe a surface, and then for the most part you look for the genetic material of the virus, the genes of the virus, and sometimes those can be found even when the virus is not active. So I would caution you about that. Lynette, am I out of time?
You're just about time, and also it probably is part of what we were going to have you say as well, or talk about in your opening statement. So I do want to go back and make sure if you wanted to just do a quick opening statement as well. And this could have been part of it, just what I asked you about what you're hearing from your constituents. But if you wanted to add to that, I will give you a few more moments to respond. Okay.
So for people, what does the public health director do, I guess? A lot of times, if there's not a public health emergency, you probably wouldn't even know that I existed. We tend to, in our clinic, treat those who can't get treatment other places. We do some well child care. We do maternity care, generally for the uninsured or underinsured. We provide vaccines. We provide treatment for sexually transmitted infections, things like that in our clinic. We work on food security through our WIC program and our nutrition programs. We do some diabetes education and management through our diabetes education programs. Generally, we're there kind of supporting the public usually from a somewhat invisible position.
But not so much now, especially with what we have going on
today.
Yes. And I do want to give all our panelists a moment to briefly talk about just their roles here. And I will start again and go back to Sheriff Paula Dance to give you a moment just to give us an opening statement as well.
Hi, I'm Sheriff Paula Dance. I am your elected sheriff here in Pitt County. Certainly the responsibility of the county is on my shoulders at this point. Who knew that we would end up in a place where something so unimaginable would happen? The responsibilities for me and my office as it relates to the coronavirus is pretty much the same. We're still going to enforce the laws of the state of North Carolina, as well as enforcing the executive order by the governor. However, we've taken it from a standpoint more of educating people. When we run into situations where people are congregating, it's more of a education on social distancing and that kind of thing. Although we do have the authority to, as we call it in our field, stroke a ticket. And we try not to do that. I mean, we are all in an area where, it's just the unknown as to what is going on now. So that's why we look at it from a standpoint of education more so than enforcement. I get calls all the time about businesses that are in the city specifically. Well, I won't even name the ones specifically, but I do try to send those to the appropriate agencies so that they are aware. In other jurisdictions, the complaints or information that's coming in. So just know that we are still here. We are still functioning as we were intended to be. We're still trying to make sure that our community is safe. And, it's business as usual for us. We're essential, and we will continue to do, what we have been sworn to do in keeping our communities safe.
All right. Thank you so much, Sheriff Dance. And now I'd like to get another minute, brief opening statement from Senator Don Davis. If you wouldn't mind just telling a little bit about what you're experiencing as you deal with your constituents wondering about COVID-19.
Absolutely, yeah. Hey, everybody. I'm North Carolina Senator Don Davis. I represent Pitt and Greene counties. And I want to first thank Representative Kandie Smith my representative for pulling us together today. And when I look at this distinguished panel and all the work that's taking place across Eastern North Carolina, I can tell the residents that I really believe that we're in great hands here, in spite of the situation that's before us with this pandemic. In response to COVID-19, in specific to my role in the General Assembly, right now I've been asked to actually focus on education. I've been knee-deep in sorting through educational issues right now, from early childhood. How are we going to continue to deal with child care arrangements as we see so many centers closing, to K-12. There are a lot of questions surrounding our schools right now. How are we going to deal with testing and so many other issues, our instructional days, all the way to higher education, as many have witnessed that our university systems have sent students home. So we're tackling a lot of the tough issues, even in our community college system. I've also been asked, having been a mayor and served as a mayor, to give specific focus to local government. And we've been working on that. I know there's a lot of interest and concerns around the sales tax, as well as personal protective equipment for the workers that are out there. So these are some of the issues that I've been working on. And on top of all of that, I've been asked to focus specifically on issues that may be unique to Eastern North Carolina. So I'm really honored and delighted to be able to rise up for this challenge, as everyone who's on this panel has done in their own various ways. So I'm looking forward to this panel and the questions that come before us. Thank you again, Lynette, for all that you do.
Oh, well, thank you very much for all that you do as well. And now we'd like to hear a brief opening statement as well from Congressman G.K. Butterfield. Good evening.
Thank you, Lynette. Let me say good evening to all of you, and thank you so very much for allowing me to come on this evening to share a few words with our viewers and our listeners. I've been living with COVID-19 now for the last 4 or 5 weeks as a member of Congress. Every day, all day, Congress has been consumed with addressing this global pandemic. And so there's so much that I could tell you tonight, but I've been cautioned to be very brief and very succinct in my remarks. But perhaps when we get into the question and answer period, I can be more specific. But let me, as Senator Davis did a moment ago, let me thank Representative Kandie Smith for her leadership. Kandie is a grassroots elected official. She serves the people, and tonight is just one example of her work. And thank you, Kandie, for all that you do. And to my good friend, Senator Don Davis, you, like me, you're on the battlefield every day. Thank you very much. And to the High Sheriff of Pitt County, it's good to see you, Sheriff. I have not seen you now in a few weeks, but thank you for all the work that you do. And to those of you in the public health sector, John Silvernail, I know your hands are full right now. And to the CEO over at Vidant, whom I've been with on the phone on numerous occasions, and Michael Waldrum, I know your plate is full as well. And so thank you, all of you, for what you're doing. As I close, let me just recognize all of the people who are on the front line in this pandemic. I know we think about them from time to time, but I want us to give special attention to the first responders and the healthcare workers who are on the front line, many of whom do not have the personal protective equipment that they deserve. Our public safety people, those who work in the hospitals and those who work in the grocery stores and those who keep our communities operating. And so thank you to all of you who are on the front line, who are deemed to be essential workers. You cannot come home and just talk on the telephone all day or be on the computer. You're out there exposing yourself to danger. So thank you very much. This is a global pandemic, unlike anything that America has seen for more than 100 years. As of today, there has been 32,000 people to die in America. Right here in North Carolina, more than 150 of our North Carolinians have passed away. And so we have a lot of work to do. Governor Cooper has been keeping us informed. I was on a call with him today, and it's good to see Lilley with us this evening, who represents the governor. Governor Cooper has been keeping us informed as to what he is doing to try to protect the citizens of North Carolina. We're going to reopen this economy. The governor's going to do it when the experts say it is time to do it. But right now, we've got to be careful. We've got to protect our people so that they will have a future. And so thank you. During the question and answer period, I'll talk about the $2 trillion that Congress has already appropriated and the money that we are trying to appropriate right now, if we can get cooperation from the Senate and from some of the other members of Congress. So thank you for allowing me to be a part of this evening.
Absolutely. Thank you so much for being here. And we also want to talk to Lilley. He's the Director of Legislative Affairs for the Office of the Governor. And we thank you for being here tonight. Kind of give us an idea from your standpoint how the state is handling this COVID-19 pandemic.
Thanks a lot, Lynette. Good evening, everybody. And I want to say special thanks to everybody who's joined us here this evening and to the panelists. It's a great group. My fellow Martin County native, Sheriff Vidant, Congressman Butterfield, for all you do in D.C., and two of our very, very best representatives in the state legislature, Senator Davis and our host, Representative Smith, who does so much for all of Pitt County communities all across North Carolina. I bring greetings to all of you from Governor Cooper. We are in the middle of this with all of you and with our frontline workers. Each day, the governor gets a series of briefings from our head of emergency management and our Secretary of Health and Human Services on where we are in fighting the disease. And it is an unprecedented pandemic and an unprecedented situation for all of us, and it has required unprecedented reaction from Governor Cooper and from local leaders and from everyone. And we've had to work together to try to fight this thing. But I think that we are making progress. I think that we are starting to see that curve that we look at every day for new infections, new positive COVID-19 cases in the state. We're starting to see that curve flatten. That's what we're hoping to achieve with our stay-at-home order and with the social distancing rules that we've put into place. We think that's vital for us to be able to take the next step, which is to begin to look at how we can reopen portions of the economy in a smart way, in an informed way, in a way that recognizes the unique nature of North Carolina and of individual communities in North Carolina. And the governor's going to be focused on testing, tracing, and trends to make those decisions. What does our testing say, and do we have adequate testing to be able to make good decisions? Tracing is the ability for our public health experts like Dr. Silvernail and our folks at DHHS to be able to track where the disease is, and can we isolate new cases of the disease so we don't have to have everybody stay home. And then those trends that we're looking for in terms of new cases, emergency room visits, hospitalizations, and unfortunately deaths, which we know are an important indicator and the most important one we should follow. So thank you very much for convening us.
All right. Thank you very much. And now, finally, we're going to conclude with Michael Waldrum, Dr. Waldrum from Vidant. He is the CEO, and obviously dealing with a lot in Pitt County and Eastern North Carolina when it comes to COVID-19. Just give us an overview of some of the things that you're experiencing and helping those that are coming in with the virus.
Thanks, Lynette. It's good to see you, and I appreciate the opportunity, and Kandie, Representative Smith, for bringing us together and having this dialogue. And I think it's so important that we all work together in this historic and unprecedented time. And I just appreciate the support that we have had in Eastern North Carolina from the governor's office, from the local officials in the Senate and the House here in North Carolina, and then on the federal level. Congressman Butterfield, thank you for your help. And on the ground here, we constantly are working with our local officials across Eastern North Carolina to deal with this really unprecedented, as mentioned, historic time that we find ourselves in. And I think, you know, the hard thing is we've never been here before. And so you asked some of the questions that we hear, and what I constantly hear is this beautiful story of what can we do, and this outpouring of support for our healthcare workers and for us that are in really at the front line to taking care of this great region of Eastern North Carolina. And the other big question that we get is, do you have capacity? Can you take care of the people that need care? And so there's a lot of fear around that, and we can talk about the issues about what go into creating capacity. But as we know, we live in this beautiful region of Eastern North Carolina, but we started in a distressed region, in an underserved region that's primarily rural with a high burden of disease. And so we're mounting this historic response on that foundation. And then the other question I get a lot is, when will this be over? And how can we turn on our economy and come out of it healthy? And I think those questions are really important because it really frames how we've been approaching our work, which is to be highly anticipatory of the issues, proactive, and looking down the road to make sure that we come through this in a very healthy way as a region and as Pitt, Greenville. And so the work that we really started off with, and I appreciate all of the support locally and at the state level and federal, is how do we decrease the surge? So get that wave down so it doesn't just wash over us. And so a lot of dialogue and education around what does that mean, and that led to stay orders and other things that have helped decrease the surge. And I do think that we are seeing a very meaningful decrease in that surge, which is important to make sure that we have the capacity. And then the other efforts, I'm so proud of our teams taking care of. We have 41 sick people today with COVID, but then we have the baseline people that need care, and those people didn't go away. And so we're taking care of Eastern North Carolina, and our team members are doing that. And during that time, we've been building capacity and capabilities to care for people over the next 2 years, and to make sure that we're able to serve our communities where they need it, and to build that capacity for the acute phase, but then to build the infrastructure to understand how this is affecting our communities over the long term. So as we turn on our communities, that we are ahead of any outbreaks, and that we take actions appropriately to decrease any spread before they get started, so the economy can flourish. So I just really appreciate all the support of our community and the work of our team members, and us having this dialogue today. So thanks.
Absolutely. And thank you, Michael, for being here. Now let's get into this dialogue. We're already getting questions from viewers on Facebook and as well as on Zoom for joining us. And I have a question now that comes from Brooke. This is to Representative Smith and Senator Davis. She says, I've been unemployed due to COVID-19 since March 16th. Issues with my online account and the inability to reach anyone by phone to fix the problem have resulted in now a 4-week period of no pay, with less than hope each day. What are you doing to help North Carolinians who qualify for unemployment but have been unable to reach anyone to file? How will we receive the back pay owed to us from our layoff date? Representative Smith, would you like to begin?
I'll begin. What we've been doing is we've been having constant updates about the system, because we know it's a mass overload of individuals applying. From my understanding, and of course, Senator Davis and Lilley could correct me if I'm wrong, when a person logs in to try, at least to attempt to apply, they should be getting paid from that date, from my understanding. So I don't want her to think that if she's trying, we do know that there's a backlog. We've added additional people. We're still working on things, but I would encourage her to contact my office, because we still send messages to have the individuals there to take a look and then try to call that person back. It's just so many people at the same time. So if she's attempted, it will go from the time that she's attempted, and she doesn't have to worry about if she gets in today, then missing on the time that she already tried to chime in to apply for the unemployment.
Representative, I hope that she understands not only will she qualify for state unemployment, but there's also enhanced unemployment that we have provided to the states in the amount of $600 extra per week. And this is for a period of 4 months. So the average worker should be receiving, unemployed worker who was laid off because of the coronavirus, should be receiving $900 per week or more.
Very good. Now, let's move on to our next question. Very similar to, of course, not just people being laid off, but those who are wondering about funding. This is directed towards in Butterfield.
Lynette.
This one is from an anonymous person. It says, will we have to claim the $1,200 stimulus check on our income tax returns?
One of the pieces of the legislation that I'm very proud of is called direct payments to the American people. If you make less than $75,000 per year, you should have already received a direct payment in the amount of $1,200. If you are married and file a joint tax return, then the amount is $150,000, and the amount is double. If you have children 16 years of age or younger, then each child will get $500 each. So for an average family of 4, that's about $3,400 in a one-time cash payment. It is not taxable. Not a penny of tax will be owed on that. We've gotten that clarified from the IRS, and you can count on it.
Thank you very much.
Hey,
Yes.
this is Don. If it's okay, I do want to step back for a second because I think there's some relevant information we would like to continue to convey because there are a lot of people, residents, who have experienced over the last few weeks concerns with their unemployment applications. And I think it's important for everyone to know that, I mean, I've never seen, and I don't know that there's ever been historically a time and period when there's been this level of rapid unemployment at the rate that this has occurred. Right now, my understanding, we have been experiencing nearly 1,000 applications coming into office each hour, 24 hours since this has occurred. We have about 617,000 applicants right now that have come in since this event has occurred. But what I want to really explain, and I want to really recognize Lee because they have to deal with us and our griping and jumping up and down and then go and work with the agents. As concerns have come, I think it's important for everyone to know and understand that our North Carolina Division of Employment Security, they have been working overtime. And what they've done is they've worked to add more employees at our call centers. They've also added the capacity of the phone system to handle the volume, more of the volumes of calls. Another thing that they've done is added to the servers so that residents are hopefully able to experience less interruption as they go online and actually to be able to get through. But what I want to do is really highlight, because I know this is has been a concern and it continues to be a concern, but I do want to highlight the work that the division has undergone, and they're working aggressively to tackle this for all of our residents. So I do thank everyone for their patience, and I would just ask along these lines, if we could maybe recognize Lee for anything else on this.
Thanks, Senator Davis, and I appreciate the words of wisdom there. And it is important to know that our legislature and lots of folks have stayed on top of the executive branch to try and get us to move the Department or Division of Employment Security in a position where it can handle this workload, which is extraordinary. We've seen about a 4,700% increase in the number of claims coming into our system. That's a lot to deal with, but we know every day that someone goes without the benefits that they need to survive is a day too long. And that's what our legislators are telling us, and we're trying to respond. I'll put some real numbers on it. We've added 350 people to the division to try and handle the workload. We know that's not enough. So over the next couple of weeks, we're going to add 800 more people to our call center so that we can take those wait times down, make sure people can get their questions answered, get their passwords changed, get into the system and get the benefits that they deserve, both from the state and federal government. And we understand it's a difficult time for a lot of people out there. We're going to be working harder and better to get them the benefits that they need.
All right, thank you so much. A lot of people are concerned about benefits, jobs, all of those things. But we do have a question about our health. And this is directed to Dr. Silvernail and also to Dr. Waldrum as well. This question comes from Victoria. She wants to know, do persons without health coverage get turned away at the emergency room? Can virtual cameras and telemedicine be used to diagnose people? Dr. Waldrum, you want to answer that about people being, if they're being turned away, or would they be turned away at the emergency room if they have no health coverage?
Sure. No, our mission is to improve the health and well-being of Eastern North Carolina. We have a federal mandate and a moral obligation to take good care of anyone that comes to the emergency room. So anybody that comes now, we have capability to segregate people, to screen them first, and then make sure that if they have symptoms or issues that we feel that are COVID related, that they get into a special track. But everybody goes through a screening process and is cared for, and then put into appropriate care settings. But if you're feeling healthy and you have questions, there are ways to get information. So we have a nurse call line that's available 24/7, 365 to just get answers. And then also, as mentioned, we thank the changes that the federal government made and that rapid deployment of virtual care, and make sure that we're able to get paid for providing services. And so the state and the federal government have cleared a bunch of hurdles out of the way. And we have seen rapid and significant growth in using our virtual capabilities, which allows us to extend the care across our great region. And we've seen unprecedented growth in virtual business and providing care through virtual care. So there's a number of different options. You can go to our website and it will direct you through those, and I'll give a highlight of exact URL towards the end.
All right, thank you so much. I don't know, Dr. Silvernail, would you like to add in case anyone is interested in, should they go to the emergency room if they feel they have any symptoms of the COVID-19?
Sure. For care, if people are mildly ill and can be managed at home, we certainly encourage them to be managed at home, to speak to their provider by phone. Many of our providers have stepped up their ability to do what's called telehealth, which includes a virtual platform similar to this, where you can speak and see your physician at the same time. I know Vidant's been busy updating their telehealth programs. ECU Physicians has updated their telehealth platforms. Last week, ECU opened their telehealth platform to anybody that wanted to use it and set that up as a flat fee. We don't provide urgent or emergent care at the health department, but all of our services are available whether someone can pay or not pay, or our fees slide to zero if someone can't pay.
All right, thank you so much. Now, of course.
Can I just say a word about that as well, too?
Yes, please.
We all ought to be very proud of Vidant. Vidant is a regional medical center that serves so many people in Eastern North Carolina. But what many of us may not realize is that Vidant, like many hospitals across the country, operates at the margin, which means that they have a lot of care which is called uncompensated care, which means that people don't have insurance. North Carolina has not expanded the Medicaid program for certain populations, and so they're having to serve people who are uninsured. And now, because of the COVID-19 pandemic, they are really being stretched thin. That's why we were able to appropriate $150 billion in the stimulus bill that we passed a few weeks ago. $150 billion for hospitals like Vidant. Vidant didn't get the $150 billion, but they certainly are entitled to their fair share of that amount of money. But we realize that the money appropriated is not going to be enough to sustain our hospitals. And so we are trying to appropriate an additional $100 billion for hospitals. Many of our Republican friends are saying that right now we don't need to do that. What we need to do is to appropriate another $250 billion for small businesses. And while that is important, we cannot invest another $250 billion in small businesses without also appropriating $100 billion for hospitals. We also want to appropriate $150 billion for state and local governments because their budgets are stretched thin and they're not going to be able to provide the services that we are accustomed to. And you know what happens when cities and counties and states have to cut their budgets? Low-income populations feel the effect of it. And so I just wanted to go on record thanking Vidant for the incredible service that they provide to our communities, and to let you know that uncompensated care is a big challenge for our hospitals.
Absolutely. Thank you so much, Congressman. And speaking of care, this question is actually directed to Sheriff Dance. This is from Latasha. She asked, what precautions are being taken for individuals who are incarcerated in county jails right now? We know around the country where jails are seeing an uptick in the virus spread. How are you all able to try to contain and make sure that there isn't a spread inside one of the jails?
Well, first of all, let me knock on wood and say that we do not have, thus far, or have not had any COVID-19 cases inside of our detention center. I recognize that we are lucky because there are so many institutions around the country that have not been as lucky as we have. Our medical staff that's on the premises has put in some very good protocols, policies as it relates to keeping our inmates as safe as possible. Law enforcement as a whole, to include the other jurisdictions around the county, has elected to write tickets instead of bringing people into the detention center when they are or have committed low-level misdemeanor crimes. And so that kind of keeps, from having a lot of new inmates coming into the detention center. But even when they do come into the detention center, they are checked out by our medical staff. They are asked questions as to, whether anyone that they've been around in their home has been quarantined or on isolation or have been diagnosed with COVID-19. We're asking those questions. Even if the answer is no, when they come into the detention center, we put them in one area of isolation for 7 days. And after that 7 days is over, they kind of go down to a step down 7-day isolation again. And then we put them in population. Our staff members that come into the detention center, we're taking the temperature, because if it comes in at this point, because we don't have it, if it comes in at this point, it would come in by staff. So we are taking the temperature of the staff members as they come in to make sure that they are not running a temperature. And we are asking all employees, not only the staff members inside of the detention center, but our law enforcement on the sworn side, to self-report when they feel that they're having symptoms or may have symptoms, whether it be a cold or fever or whatever, to self-report those things so that we can make sure that we are not exposing our inmates to any thing coming in from the outside. Again, we've been very lucky, and we've got some very stringent procedures and policies inside of the detention center in hopes that we won't have that come in. But again, and I have to give a lot of credit to our medical staff who are there on staff daily, prepared to handle any of those situations.
All right, thank you, Sheriff Dance. This next question comes in and is directed to Dr. Silvernail or Dr. Waldrum. Why is there no drive-through testing being done in Pitt County right now, considering the fact that one of the requirements is to contact your primary care physician in order to receive a test, but a lot of people don't have primary care physicians? Wouldn't this be useful?
I can speak to that, Lynette. Several of our practices are doing drive-up testing. Physicians East has drive-up testing. As long as you've been seen in any of their offices, they will see you through their urgent care and test you at their urgent care. ECU Physicians has opened up their telehealth platform to anyone for a flat fee and offers drive-up testing to go with that. And I believe Vidant Family Medicine in Greenville is doing a drive-up testing service. We have done some drive-up testing in very limited situations where people did not have access to care or as part of our exposure investigations, but I would offer that response.
Okay.
There's also no recommendation for mass testing or screening right now of asymptomatic folks.
And John,
So
could
we're
you speak to diagnostic testing versus antibody testing? Are you familiar enough to speak to that?
Sure.
Yes.
Sure. The acute testing is what's called real-time PCR, which is a test that in most cases uses material from the nose to look for the genetic material of the virus in that patient. And that's used to see if someone is acutely infected with COVID-19. The antibody testing is used to detect the presence of antibodies or immunity to the virus. And that would be done anywhere from 2 to 4 weeks after that individual developed the infection to look for those antibodies. So that can tell us more broadly in the community who was infected, but it's generally not used to tell us who is infected at the moment.
That's a
Lynette,
big conversation here in Washington, diagnostic versus antibody.
Mhm.
yeah, Lynette, maybe a few comments on that topic. I think that the question's a great question, and there's a lot of confusion, as was just alluded to, about testing. And I think that the issue really goes to what Dr. Silvernail said, which is a lot of the tests that are available through drive-through and other, actually, it may take days to get the test result back. So it's really, if you think you have it, you might have it, and you need to treat yourself as you do have it. And then the rapid testing, PCR, high throughput testing, and serologic testing, the capabilities, when I mentioned earlier about building capacity to deal with this, it's bringing different technologies and capabilities to Eastern North Carolina. And so we're really excited about what Vidant has done with our partnership with ECU Brody School of Medicine and building testing capacity. We have the largest testing capacity in Eastern North Carolina with PCR. It's rapidly growing. At this point, we're able to do 1,000 PCR tests per week. And so those you really want to use those rapid testing for people that you think are more likely to be in the hospital or that you're going to change your therapy for, because part of that capacity is to be able to make sure that you know who has the disease so we can protect our healthcare workers and conserve personal protective equipment. And so, which is also in short supply in the country. So the rapid testing capability has grown rapidly, and we're continuing to grow it. And our goal is really to be able to have it, and we actually today started doing it in our community hospitals. And so to have this rapid testing at the point in our communities is really important long-term to be able to turn our communities back on in the economy, and to be able to rapidly react when we do, to know what's going on in our communities, which was alluded to earlier by Mr. Lilley. And then part of that will become the serologic testing. And I'm so proud again of the team that we have that all across our organization that has done a lot of different work, but in testing specifically, next week we will be turning on 2,500 tests per week, with up to 10,000 tests per week coming online within 2 weeks from that. And so being able to monitor and who now has immunity and who doesn't, and then the ones that don't, be able to rapidly test them, will allow us to react much more quickly in our communities to protect our communities when we turn the economy back on. So it's a very important question, and I'm just so proud that we are going to be able to protect Eastern North Carolina in the future and the capabilities to do that.
Now, some people wonder if there's a cost to that test. Does it depend if you have insurance or not?
No, again, thank you to our representatives. Again, elected officials, local, local, state, and federal. So many things have been done, but part of it has been action at the federal level to I think it came into effect today. Congressman Butterfield, you correct me. I'm busy building capacity and taking care of folks, but they've been gracious to say no, that the feds will cover that. And so there is a cost to doing it. We have to buy the reagents and the machines to do that, and we bought those and are putting them in place, as I mentioned. And so there is a guaranteed payment from the federal government for that test for anybody that we think needs to be tested.
That's correct.
All right. I have another question that came from our Bethel Mayor, Glorstein Brown. She has this question for Lilley. She wants to know, where do we stand on extending the stay-at-home order?
That's a great question. Appreciate it. And it's probably the question we get the most is how long are we going to be in a stay-at-home posture versus when can we start to get the economy going again? The governor began to introduce that earlier in the week. He talked again about those 3 T's that we're trying to do. Testing, Dr. Waldrum, Dr. Silvernail just went through a lot of the issues around there, but we want to be able to do both diagnostic testing and this antibody testing. The tracing, the ability to find people who are ill and isolate them and isolate their contacts so that we don't have to have a widespread mitigation effort that keeps everybody at home, but instead targeted efforts to find sick people, treat them, and keep them in a quarantine position. And then trends, we're looking for those specific trends. We've seen lots of data come out of this process about where the disease is, where it's moving, how quickly it spreads, and it is a very virulent disease. So as we learn more about it and where it goes and how it moves, we're able to make better decisions about when we can adjust or lift the stay-at-home order. It currently extends to the end of this month, April. We also have the closure of K-12 schools that go until May 15 at this point. Governor is going to work within that framework, the 3 T's framework, to determine with our public health experts, with our leaders in the economy, and with other elected leaders, how to begin to make adjustments to let more of the economy breathe, but also try to keep us safe. He's described it not as flipping on a switch, but using a dimmer. So slowly moving us back. If we took everything off at once, we know from our modeling, we would put our hospitals and our frontline healthcare workers in great jeopardy because we would likely overwhelm the system with sick people. So we want to be really careful about this, and we're going to have to watch it as it goes. We're going to turn some things on, and as we watch, if we see that the trends are ticking up in the wrong way, we may have to move back again. It's going to be a process as we get into this new normal. Governor will be on a press briefing tomorrow afternoon, and that will be at 2 o'clock. That's broadcast over WUNC and through the State Department of Public Safety website, where he'll offer some more details about the direction we look to head over the next couple of weeks.
And speaking of that, of course, we're concerned about leaving home, being able to get back to work. Some people are also concerned about tourism. We have Andrew who's watching live, and he asked via Zoom, is the House and Senate working on legislation for the state? And what are you doing to protect tourism? And this is directed to Senator Davis and Representative Kandie Smith. Don, would you like to take that one first?
Absolutely. Thanks so much, Lynette, and thanks for that question there. What we are acknowledging, there's been a lot of work around getting our economy back going. And when we think about the small funds for small businesses, that those federal dollars, as we saw, have basically went pretty quick. I think Congressman Butterfield could speak towards that. But what we're doing at the state level is we're actually looking at a relief package that would encompass a package that will help to fill somewhat of a gap that may be out there even after the CARES Act. So right now there's been conversations around about a $75 million package or so that would help us to continue to reach out to small businesses across the board so we can, as that dimmer is turned, get our small businesses in particular up and running again. And more importantly, to try to fill those gaps. I would also add, when we look at the time between SBA loans, for instance, taking effect, we also have seen movement towards bridge loans. So there's been a lot of attention towards the economy. How do we support local governments as well coming out of this? You heard the Congressman mention potential additional federal funds. Those are things that we continue to keep our eyes on, and more importantly, look for any gaps that may exist between any federal funds and what we need as a state.
And Representative Smith, would you like to add anything to that?
No, I think he's done a wonderful job of answering that.
Excellent.
Well, if I can jump in, Lynette, and just say that every sector of the economy is feeling the pain. Certainly the tourism industry is one of our major drivers of the economy, but it's more than that. It's our manufacturing and entertainment and hospitality sector. And even our colleges and universities are feeling the pain. And so there are a lot of sectors that are being affected, but the governor cannot, in the interest of helping these sectors, prematurely reopen the economy. If he does that and does it in a way that does not benefit the population, we will see a resurgence of this virus, and I'm sure we would all regret it. And so we've got to be patient. We've got to be patient. We've got to listen to the experts and reopen the economy when it's time to do so. Each state is going to be different, no question about it. I was on a call today with some people from Nevada. Nevada has lost at least the city of Las Vegas has lost a 70% revenue base because of the pandemic. The territories, the Virgin Islands, for example, has seen a tremendous decrease in their revenue, and the local governments are not able to withstand this type of stress. And that's why we need to invest money in what we refer to as stabilization funding. That is appropriations to the states and appropriations to small communities such as Greenville and Fountain and Farmville and Falkland and the other areas there in Bethel and the other areas there in, my friend is the mayor of Bethel, so I had to throw that one out. But we've got to make sure that small communities have federal dollars so that they will not drown.
Thank you so much. Now, as we mentioned, this is just an hour-long virtual town hall, and of course we could continue going on, and we know that we've had several people who had questions that through Zoom or through Facebook, but we're going to have to conclude tonight because we want to we can give each of our panelists and local leaders here an opportunity to do just a minute or two of a closing statement, just something that may be on your heart, on what you can say to the public here, not just in Eastern North Carolina, but anyone who's watching who may be concerned with the COVID-19 virus, their jobs, of course, worrying about the economy, anything that you may feel that would be some hope maybe for some of those who are home wondering what's going to happen next. So we're going to conclude, and of course, in the next few days, I want to mention that the office of Representative Kandie Smith will be taking time to respond to the other questions that we couldn't get to tonight. All of you who are out there watching us live on Facebook and on Zoom, we will, of course, try to get to those questions as well that were sent to us via email. But let's go ahead and get those closing statements right from our first leader, Dr. Silvernail. Would you like to go first on a closing statement on maybe just some hope that we can give our viewers out there on what they can do to protect themselves?
Was that for me? I'm sorry.
Oh, I was trying to get with Dr. Silvernail, but if Michael, do you want to? Okay.
You clipped out when you said the name. It actually blanked out in the audio.
Oh no.
I'm sorry.
That's okay. We're going to start with you, if we could, just to talk about a little bit of some hope that you can give in your closing remarks as people are concerned about the COVID-19 virus.
Sure. First, thank you to the people of Pitt County here for heeding our advice, for staying away from each other, for washing your hands. I know it's been difficult. I know there's economic pain, there's emotional pain. I think there are reasons when we look at our surveillance data, our case counts and things like that, to be very hopeful that we have done the right thing to decrease the size of the wave and to make it more manageable so that healthcare demand and healthcare needs are well matched, and that we don't have to make those horrible decisions that were made in other places of deciding who gets a ventilator or who doesn't get a ventilator. So I know it's been a painful process, but I think there are reasons to be cautiously optimistic that what we have done has worked, and that while the hospital census has increased a little bit, they're still able to meet that demand, and I believe still have some reserve, and I'll let Dr. Waldrum speak more to that. I am so pleased with how the medical community has done, how people have done in terms of following isolation and quarantine orders. And just as a point, we isolate people who actually have the infection. We quarantine those who have been exposed. And generally the quarantine is only of those who have been directly exposed to the case. And there's sometimes where we've had the context of the contacts putting themselves in quarantine. So people have certainly heard that message and heeded that, sometimes perhaps even a bit excessively, but in the end, it didn't hurt anybody other than maybe staying home a little bit more than you needed to. But it was good to see folks listening to that message and acting upon that message. I said last week that it's time for us not to be afraid of COVID and time for us to make COVID afraid of us. We know how to protect ourselves in terms of the spacing. If you're sick, to stay away from folks, don't expose folks, especially if you know you have COVID, don't expose folks. If you are sick, wearing a mask certainly decreases your ability to spread the infection, so that's a good idea. In terms of it protecting you from getting the infection, the jury's still out on that, but if you feel more comfortable wearing a mask to protect yourself, I think that's absolutely okay to do. It doesn't have to be a hospital grade mask. It can be one of these cloth face coverings to wear out in general public. I think that's just fine. But overall, I really want to thank you all because you have heeded our advice and done a good job. And I think have really helped decrease the size of the wave and to spread that wave out so that the medical community can handle that as we go forward. And again, I'd like to thank everybody for the chance to serve as your public health director. I've only been in the job for about 9 months right now, but it feels like probably 9 years. But thank you. Thank you for allowing me to serve in this role.
And thank you for being here. And Dr. Waldrum, we'd like to get a brief closing statement from you as well.
Yeah, so it's COVID time, and weeks feel like years, and we anticipated and saw this, and I just can't thank the community leaders, elected officials, and everyone in North Carolina working together to actually do the right thing and anticipate that hurricane and the eye of those storms hitting all of our communities. And by the actions taken, we've lessened the impact and lessen the impact actually in lives lost and economy lost. And a community that is less impacted and less devastated will recover quicker and better than if it just let the wave come over it. So I just think that the behaviors and the things that have been done are so important for our long-term economic growth, especially in one of the most underserved communities in the United States, that's Eastern North Carolina, because our foundation and our people deserve that hope and opportunity. So I just want to thank all of the elected officials that helped make all of that happen. And because in this very COVID time, in a very short period of time, we've learned and adjusted with and built capacity and capability, whether it's new models of care, new telehealth, new testing capabilities, new monitoring capabilities, so we understand in the future and are able to recover faster. And so I think there is hope, and with new technologies and capabilities in analytics, there is a great opportunity for us to beat this virus, unlike 102 years ago. And then lastly, I just want to thank our team members and our doctors and nurses and people that are actually in a really scary situation, going in every day, 24/7, 365, in 9 hospitals and over 100 practice sites across Eastern North Carolina to serve and to make sure that we meet our mission. And so that's a scary place to be, because that's really at the front line. And I'm so inspired every day by that work and then the support they have from their local communities in doing that work. So I just want to thank all of them for that very, very hard and important work.
Thank you so much. And Sheriff Dance, I'd like to get a closing remark from you as well.
First of all, I really want to give my appreciation to our medical staff, the nurses, the doctors. They have been frontline this time. Generally, when we're in crisis, we generally, as law enforcement, find ourselves as frontline, but our doctors and our nurses are our heroes. We're here to support them. We appreciate everything that they do. You know, I'm always on social media pushing social distancing, wash your hands. People probably get sick of hearing me say that, but it's share if people listen. And if it's a reminder each day in saying that, when they open their Facebook or their social media, they know Sheriff Dance is going to say practice social distancing, wash your hands, make sure that if you don't have to be out, don't be out. We know and recognize, you know, we have essential things that we have to go out for, doctor's appointments or picking up medicine, or most importantly, food. When you're sitting at home all day, you definitely need food, probably much more than you normally eat. But, you know, I'm always pushing that because I recognize as being sheriff, as an elected leader, people need to hear things like that coming from the sheriff. If the sheriff is saying it, if the sheriff is doing it and she's leading the way and doing it as well, then hopefully others will continue to follow and take it as seriously as we do. Our officers are practicing social distancing. We have to be out there, but we are also practicing social distancing. We're a little short on PPEs, but we recognize who our frontline folks are. Those folks need those PPEs. And you know, one day, I know we woke up one day and the world had changed, and hopefully one day soon we're going to wake up again and the world's going to be back where it was before. There is always hope, and as long as we're still breathing and living, we've got hope, and that's what I'm clinging to, and just going to continue to set the example in understanding how serious this is.
Thank you so much. And Lilley, we'd like to get a closing remark from you as well, especially from the state, on what people can expect and how to move forward as the days ahead. And we are kind of in an unknown holding place.
Sure. Thanks, Lynette, and thanks everybody. You know, we are going to continue to share over the next couple of days what we think the plan will be, what are the indicators we're looking for to be able to take the next step, try and move us in a place where we're keeping people safe, but beginning to release some parts of the economy. You know, I just want to say that the order that we were working through here is we need to save lives. I think we're working on that. 2, we need to protect our healthcare system from being overwhelmed by the speed of this virus. I think we're on the right track there. And then the third thing is to focus on how we get our economy back on track. And that's what we're focused on squarely as well. We know that by staying home and social distancing, we are having success here. We are flattening that curve. That does give me hope, and it gives the governor hope. We look at the statistics, the largest state in the United States by population, but we are probably 21st or 22nd in terms of confirmed cases. And because we've had people who have taken this seriously, acted early, and been aggressive in trying to fight this disease, we got to stay on that trajectory to be able to take the next steps, but we're hoping to do so in a couple of weeks. We also know that there's real hardship out there, there's real pain out there, but together we're going to beat this thing. The governor's native Eastern North Carolinian, I am too. We know that Eastern North Carolinians are resilient, whether it's hurricanes or the economy or anything else that confronts us. We stick together, we rebuild, and we do what we can to move forward. So I just would end by saying, please pray for the families who are impacted by this disease. Pray also for our heroes out there, frontline healthcare workers. Everybody has mentioned that, but we have to remember how hard they're working and the great danger that they face every day. And of course, for our first responders, the first people who may come and encounter someone who is ill, pray for them as well. If we help each other, we'll make it through. So thanks very much, everybody, for convening, and thanks for what you're doing.
Thank you for what you're doing as well. And Senator John Davis, may we get a few remarks from you as well?
Thank you so much, Lynette. And let me say, there was nothing more touching in the midst of all of this when I was able to watch our law enforcement community go to Vidant and encourage our healthcare professionals as they were changing shifts. That's the spirit of Eastern North Carolina. And yes, indeed, we are resilient. Let me thank Representative Smith again for organizing this virtual town hall, bringing us all together, an awesome panel with an awesome facilitator. And indeed, I count it an honor and a blessing to be able to serve the residents of this state in the North Carolina Senate. During these trying times, I've spent a lot of time communicating with our federal leaders, Congressman Butterfield, all the way down to our local officials, as well as my colleagues, as we prepare to head back to work at the General Assembly on April the 28th. Part of our goal is to fill the gaps that may be out there. We are doing everything to work for the people. And I would like to make sure everyone understands that we hear many of the concerns that are being conveyed. We're trying to provide answers to questions like, how are we going to handle school? How are we going to handle waiving interest on the tax payments? How do we consider, or do we consider delaying registration on our cars, helping small businesses, also addressing in the midst of this pandemic, when we see the disparities that are taking place amongst African Americans. These are things that we have to continue to address and tackle. So as we continue to practice physical distancing, washing our hands, and limiting our travel for essential purposes, let us keep checking on each other, calling a friend, video teleconferencing with a family member, having these sessions with constituents. And above all, when we see the real impact of this pandemic, for those of faith, it's altered our way in which we practice our faith. But this is a time now more than ever that we must stand on that faith. And I truly believe that we will get through this by the grace of God. So thank you so much for allowing me to participate, and may God bless each and every one of you, and may God bless our state and Eastern North Carolina.
Wow, thank you for those encouraging words. And now if we could get a closing remark as well from Congressman G.K. Butterfield.
Let me also thank you, Representative Smith, for pulling us together tonight to have this conversation. It's been a very interesting and important conversation. Thank you so much for your leadership. You know, I was just looking at Senator Davis here on my monitor and thinking about his role there in the North Carolina State Senate, and it's an awesome role. I was looking at our friends at the Health Department and the CEO of Vidant. All of you have different roles to play in making our communities whole. Law enforcement has a role to play, but my role as a federal representative is to bring you information, but more importantly, to bring you resources. And that's what we've been doing over the last 5 or 6 weeks. The first thing the Congress did was to appropriate $8.3 billion. The president had asked us for 2.5, but we ended up appropriating $8.5 billion for testing and for investing in some type of research to find a quick vaccine for this dreaded disease. That was the first thing that we did, $8 billion. 3 weeks later, we passed a $100 billion package that provided money to healthcare providers to get ventilators and PPEs and the other essential equipment that they need to do their work. But after doing all of that, we realized that our work was incomplete. Then it was time to invest in people and in families and workers who were laid off, and to invest in helping small businesses to recover, and even those who have large businesses. And so we realized the need to have a more than $1 trillion investment in families and in businesses. And that's when we came together, Democrats and Republicans. We had our different views in the beginning, but at the end of the day, it became a bipartisan package that we cobbled together, $2.3 trillion. And in there, we provided direct payments to every American who makes less than $75,000 a year. We provided unemployment insurance, enhanced unemployment insurance. We invested in our hospitals and our medical providers. We've invested in helping students who have student loans, and I know that's very important in Greenville and Pitt County. We have deferred student loan payments for some 6 months. The government will pay the principal and interest on these loans, and so we have done a lot over the last few weeks in appropriating money. It is the federal government that must come to the rescue during these times. But now we realize that we need to provide more money. Dr. Waldrum and his colleagues all across the country are asking for more resources. They are telling us every day, we can get the job done, but we've got to have the resources. those in the chambers of commerce and those who represent business interests are telling us we need money for small businesses that are closing and they may not ever be able to reopen again. And so we put $350 billion into the small business program for small business forgivable loans. But now we're realizing that 350 was not enough. And so the Republicans in the Senate have come to us, the Democrats in the House, and have asked us for an additional $250 billion to invest in small businesses. And we've said to them that that is a good idea, but we need $100 billion in additional funding for our hospitals and community health centers and health systems across the country. We need $150 billion for state and local governments who are going underwater as we speak. We need a 15% increase in food stamp allotments to help low-income families who are food challenged to get through this crisis. And the political dilemma, and I'll close with this, the political dilemma we have right now, and I want you to watch it on TV tomorrow and throughout the weekend and perhaps the first of next week. The only thing that the Republicans in the Senate have agreed to is the $250 billion for small businesses. As of this evening, they had not agreed on the $100 billion for hospitals, nor the $150 for state and local support, nor the additional food stamps. I hope and I pray that over the weekend, the Republican and Democratic leaders will come together once again, have a bipartisan agreement, and hopefully on Monday or Tuesday of next week, we will be able to make a grand announcement and we will be able to pass it on a voice vote so that members will not have to expose themselves to the disease by getting on airplanes and coming back to Washington prematurely. I hope and pray that that happens, and I ask you to pray for our country and pray for those who are on the front line, pray for those who are affected by the coronavirus, and thank you again to, almost said Senator Smith, to Representative Smith for your incredible work. I look forward to seeing all of you in the future. Thank you.
All right, Congressman, giving us some insight on some things that are coming down the pipeline. We thank you for that. And we do want to conclude with who we began with Representative Kandie Smith, who, of course, was so instrumental in putting this town hall meeting together virtually on Zoom. Your closing comments tonight. And Kandie, we would need you to put on your microphone for us if you could.
Okay. Thank you so much. I was trying to make sure I didn't block anybody else out from speaking. But thank you so much, Lynette, for all that you have done for us through moderating this. Thank you so much to everybody who participated tonight. You guys are essential. And I know that people in the community have many questions, and we want to make sure we dispel as many myths that we can and give reliable information. And that's what you guys have done. We've gone through a lot, but I know that we didn't get through everything. So I want to make sure that everyone knows that my office is always available to help you with these issues that you may be having with any of our state agencies. And we will be answering the questions. If you sent any questions and you sent your email address, we will still continue to make sure we get these questions answered for you and email that response back to you. The best way to reach us is by email. And you can email me anytime at kandie.smith@ncleg.net. Again, KANDIE.SMITH@ncleg.net. Or you can call us at our office, and that number is 919-715-3023. All of that information is also on our Facebook page, so please contact me anytime that you need us, and we'll help you in any way that we can, or we'll put you in contact with someone who can assist you. Just repeating the sentiments of what everyone has said: stay safe, make sure that we're practicing all those things that we know that we should with our social distancing, washing our hands. I more importantly want to just say, take care of yourself and then take care of each other. And if we do that, I think that we will be okay. And thank everybody again, and God bless you.
Well, I want to say thanks to all of you for your insight and your expertise. Obviously, this is a definite unprecedented time that none of us would have ever imagined we'd be going through in our lifetime. So we do thank you for all that you're doing to serve the people in light of this deadly virus that is sweeping our country, our nation, and the entire world. So to all of you tonight who tuned in, thank you so much for being a part of this. And we hope that we've answered some of those questions. And again, if you have more, you can continue that conversation on Kandie Smith's Facebook page as well. But we thank you all so much for being here. Be safe, check on your neighbors, and just remember that we're all in this together. Have a good night.